In terms of the trajectory of patients who are diagnosed with a lung mass or suspected lung cancer, our team here of thoracic surgeons, we work both at the Montreal General Hospital, at the Glen site or the Royal Victoria Hospital, and at the Jewish General Hospital. And patients from all over the island of Montreal are usually seen by pulmonologists at these sites. At our McGill site, they're usually referred to what we call the Rapid Investigation Clinic, which is run by our pulmonologist at McGill. And the patients are seen there and they get a rapid workup, including CT scans, PET scans, nuclear imaging if that's required, more advanced type of scans if that's needed as well. And then they get usually pulmonary function tests to assess their pulmonary reserve and their candidacy for surgery. Once the workup is completed, then the patients are usually referred to see the surgeons or the oncologist or radiation oncologist in the same setting in what we call the lung cancer clinic. So patients are often seen in the lung cancer clinic by multiple members of the thoracic oncology team. And we usually go over the diagnosis, the stage of the disease, if that's applicable, and then we decide all together as a team what is the best way to treat every patient and every cancer, which may include surgery, chemotherapy, immunotherapy, and radiation therapy. And this is usually also where we discuss the candidacy for certain patients to clinical trials and more innovative types of treatments. So patients with what we call resectable lung cancer, so lung cancer that can be removed, are often referred to us as surgeons, and sometimes they can be operated on right away, and some patients with more advanced tumors usually can undergo some kind of systemic treatment like chemotherapy before coming to surgery. But when we see them here in the thoracic surgery clinic, we usually review the imaging once again, and we assess if the tumor is indeed removable, if the patient has enough lung capacity to be able to have that piece of lung removed and still be able to breathe and function and live a good life and with a good quality of life without that piece of lung. We work with a great team of pulmonologists, oncologists, and radiation oncologists in Gatineau, as well as a team of gastroenterologists as well. So usually the patients need to come here for the surgery itself. However, all the before surgery imaging, diagnostic tools, and all the follow-up can be done there. We have 2 nurses that we work with very closely in Hull that have really excellent relationship with our patients there and who are able to answer their questions as needed before or after surgery. And we obviously communicate with them on a daily basis to make sure the patient's needs are met.